How many of you have received a medical bill like this one that shows your health insurance company being charged a significantly reduced amount for medical procedures, sometimes by over 80% of the total bill, but at the same time, you've seen a substantial jump in your out-of-pocket expenses for healthcare? If you're like me, and I certainly hope you're not, your healthcare premiums beginning January of this year, on average, increased by 25%. And in my case, that amounted to $370 a month that was stripped from my paycheck. So, what happened? It's been a while, but I'm back. And in that vein, I'd like to welcome all of you back to the office of the Patriot, the place where I try to make sense out of the nonsense of the progressive left and rhino right. For those of you who just stumbled onto my channel, my name is Myron Ybarra, and, well, I'm your host. Using the like button, how many of you have seen an increase in your monthly healthcare premium? Like I said in the intro, mine had increased about 25% of what I was paying in 2025, which is still a crazy amount. So today's discussion is going to encompass everything and all things ACA, also known as the Affordable Care Act or Obamacare. From its inception to the current iteration of the ACA, the problems that have plagued this program, and ultimately, how we can fix this mess. All right. Obamacare is a law that was enacted in 2010 to help Americans with healthcare costs. And according to the HHS.gov website, Obamacare has three primary goals: to make affordable insurance available to more people,
bullshit,
via subsidies that lower costs for households with incomes between 100 and 400% of the federal poverty level. And for those of you who don't know what the current federal poverty level stands at, as of 2025, for individuals, it's $15,650, and for a family of four, it's $32,150. And this information is retrieved from the healthcare.gov website. And as always, all the receipts and resources for today's presentation are listed in the description section below. Next, Obamacare was designed to expand the Medicaid program to cover all adults with an income level below 138% of the federal poverty level. And finally, Obamacare was passed to support innovative medical care delivery methods to lower cost of healthcare overall. But here's the question: has Obamacare done what it was set out to do? In my humble opinion, it has not. And if I'm being completely frank, Obamacare was actually designed to fail. Yeah, you heard that correctly. Obamacare was designed to fail. You see, former President Obama and all of his Democrat lemmings really didn't want insurance companies in the process of disseminating healthcare to Americans. They wanted the government to do it under a single-payer program. And who do you think Americans would be paying? Well, the government, of course. But Obama also knew that most Americans were not ready for socialized healthcare. So in comes Obamacare, an unnecessarily convoluted healthcare law that hamstringed healthcare insurance providers, healthcare recipients, you and I, and medical providers. It's my belief the goal was to get the system to fail so people would be so fed up with insurance companies that they would voluntarily surrender their right to choose for the promises of comprehensive healthcare for all. And you're seeing that today on many social media platforms, especially from progressive Democrats. Some of the promises that Democrat politicians, to include Obama, made to sell this boondoggle to the American people was that it was going to prevent the evil insurance companies from excluding people with pre-existing medical conditions. It was also going to focus on preventative care and mandate that insurance companies include a number of different treatment options in their insurance packages. Plus, the federal government made health insurance, or having it, compulsory. So you didn't have a choice. Well, you did have a choice, but the choice was either get the insurance or get fined by the government for not having insurance. Either way, someone is getting your money. Now, here's where things get a bit sticky, because Obamacare put prerequisites into law that mandated specific coverages to be included in the health insurance package that people were offered. And these included ambulatory patient services, behavioral health services, chronic services, emergency services, laboratory services, maternity and newborn care, prescription drugs, pediatric services, rehabilitative services, rehabilitative devices, wellness services, and oral and vision care. And most of you are probably like, oh my God, this is awesome. We get all this coverage. Well, If something sounds too good to be true, it usually is. And in this case, there is a number of coverages that insurance companies are providing on paper, but they know that some people will never use. As an example, let's say you're a single adult male and you have a silver tiered medical insurance plan. Do you think you're ever going to need maternity care or require preventative female procedures such as a pap smear or mammogram? I'm asking this as a rhetorical question because the answer is no, you're not, even if you claim that you're gender fluid. You see, insurance companies are not upset about providing this coverage because they're collecting the premiums either by virtue of you paying for them, your employer paying for them, or the government paying for them, or a combination thereof. The fact of the matter is, millions of Americans are paying for coverages that they will never use. Next, Obamacare allowed the insurance companies to make the determination on the scope of the benefits within those mandated coverage categories. Under Obamacare, there are 4 tiers of coverage. I'm sure most of you have seen them when you went to the healthcare marketplace in your respective states. They were bronze, silver, gold, and platinum. The patient costs for each one of these tiers are based on the concept of actuarial value. And if you're like me, you had no idea what the hell actuarial value is. So I checked it out for you. And according to the healthcare.gov website, actuarial value is the percentage of total average cost for the covered benefits of your healthcare plan. As an example, most silver-tiered plans have a 70% actuarial value, which means that the plan owner would be responsible for paying 30% of the benefits. Now, the insurance company is the one who decides on how they're going to defer that 30% to you via deductibles or co-payments or co-insurance or a combination thereof. Just because you happen to have a silver or gold tier or even a platinum tiered healthcare plan doesn't mean you're not going to be responsible for more than the actuarial cost of the plan for that year. In some cases, it could be up to 50%, you being on the hook for 50%. And many plans have a maximum out-of-pocket requirement before your benefits even kick in. And again, none of this was addressed in the ACA law. Many people like myself didn't realize it until well after the bill was passed. Because, well, we were told this.
But we have to pass the bill so that you can find out what is in it.
The Democrats who passed this fecal matter show onto the American people under the guise of compassion knew full well that the insurance companies were not going to be able to sustain this level of coverage without some type of government subsidy. As a result, Democrats okayed billions and billions of tax dollars to go to insurance companies in the form of these subsidies. So again, if you're like me, not only are we paying significantly higher insurance premium rates, but for quite some time, a significant portion of my taxes subsidize the insurance companies and the people on government-funded insurance programs like Medi-Cal and Medicare. So they're getting paid twice from the pocket of the American taxpayer. Because again, if you're like me, a 25% increase in healthcare premiums is, well, much like a kick in the nuts. The problem here is deciding how we fix this mess, especially in the short term, because it doesn't appear Congress can collectively pull their heads out of their asses long enough for them to take in the air necessary to allow their brains to function properly. So this is going to be left to Trump to fix, likely with executive orders. First, what we don't do is reinstate subsidies. You don't just throw money at a problem thinking it's going to fix it. It never does, especially if it's my money. I'm kind of selfish like that. Trump has already attempted to fix the Obamacare mess through Executive Order 13813 back in 2017, where he directed his administration to facilitate the selling of health insurance across state lines. It's my belief, and evidently Trump's as well, that opening the sale of insurance across 50 states will promote competition between companies and give customers more options. But of course, many Democrat states oppose this under the guise of consumer protections and the potential of destabilization of insurance markets in their states.
Bullshit. Bullshit. Bullshit.
It's my hope that Trump's legal team reworks the executive order that was rescinded by Biden to make this workable in this term. In addition, I would have Trump, or rather I would suggest Trump, sign an EO that mandated insurance companies to allow for the sale of coverage a la carte as opposed to the comprehensive packages we have today. And this would allow consumers to only pay for coverages they feel they need at the level of coverage they can afford. As an example, if you're a young man in your 20s, you might opt for platinum emergency services, but a gold internal medicine policy. And this allows you to tailor your insurance needs to your physical and economic health. And again, take power from insurance companies and government and return it back to you and I, the consumer. Next, along the same vein, approximately 60% or about 165 million Americans have their health care coverage through their employer. In virtually all circumstances, the employer and or unions contract with various insurance providers who offer their policies, again, in a one-size-all-fits fashion. What should happen is employers provide an agreed amount of funds towards healthcare. Now it's up to the employee to find healthcare insurance that will work for him or her and their family. And in my case, this is especially important because my employer pays me or pays the insurance company $2,200 a month towards my healthcare premium. And given my location, I'm only eligible for one of the 6 available providers. This healthcare provider has a premium of almost $3,200 a month, which puts me on the hook for nearly $1,000 a month. If I was given the $2,200 a month to find my own insurance, I could cover my wife and I at $2,200 to $2,500 a month. And this would give me a net savings on the low end of, say, $700. But let's say I didn't require the comprehensive healthcare plan that I currently have. So between my wife and I could find one for, say, $1,500. Well, in that case, the executive order can mandate that remaining funds that are supplied by the employer for healthcare insurance be used for that purpose. So all the funds that remain following the healthcare purchase could be put into a health savings account to offset deductibles and co-pays and co-insurance, also reducing the out-of-pocket costs for millions of Americans without touching any of their net income. And finally, I would have a revision to the hospital price transparency rule. This revision would require healthcare and insurance providers to have only one price for the products and services used in the distribution of healthcare services. Hospitals, doctors, clinics would no longer be able to issue a $10,000 bill for services to insurance providers that gets negotiated down to $1,000 because of preferred provider status. If you pay cash, if your insurance pays or Medicare pays, the bill for the service would be the same for the same treatment. This reduces built-in subsidizing of healthcare services by cash-paying patients and top-tier healthcare insurance companies. The cost of the service would be equalized by market demand. If one hospital charges $1,000 for an x-ray and the hospital 5 miles down the road charges $500, it's a sure bet that the hospital that charges $500 will receive a larger market share of patients who require those x-rays. I mean, it's just common sense. The real way to get all of this fixed is to, do away with Obamacare, but the likelihood of this happening before the midterms is impossible. After the midterms, and depending on the outcome, we may be able to get it done. Until then, something is needed to offset the rising cost of health insurance for most Americans. Maybe start using some of the tariff money, or better yet, reduce the federal income tax rate percentage. Or, let me know what you think. How would you deal with the rising healthcare costs? Go ahead and give me your take in the comment section below. And this concludes today's episode of Office of the Patriot. And if you enjoy the presentation, please take the time to like, subscribe, and share this channel on your social media. It's appreciated. Also, please take the time to comment. Viewer engagement via comments is the major metric for channel accessibility on most social media platforms like this one, and YouTube, and Facebook, and Threads, and Rumble. The more people that like, subscribe, and comment, the more this channel will come up when social and political content like this is searched for. And as always, have a blessed day and stay safe out there.